So we continue with our series on how to answer pharmacology questions. This is number 2. Like I said, test taking strategy, straightforward questions, but there's keywords. Use that strategy to answer any pharmacology question. You can pause the video, see what I'm doing, and see if you can answer the question, and see you can compare what you're doing with what I'm doing. Number 1, like I said, pharmacology. You don't have to sweat about it. Which findings? I'm looking for findings will indicate adverse. The word is adverse effect, not therapeutic effect. Adverse, bad stuff. That is the ask of the question of the medication. And next is caring for a client with what? Diagnosis. Diabetes insipidus. It's not mellitus. It's an insipidus. Desmopressin is prescribed. Which finding will indicate adverse effect of the medication? Rewrite the question with your case and your buzzwords. Patient has DI. We give the patient desmopressin. Which of these side effects or finding is an adverse effect? Non-therapeutic. Range your content. Pharmacology is the same test-taking strategy you can use to answer anything, whether regular question or pharmacology, whatever they give you. You see how I break it? EI on desmopressin, what shows is an adverse. Then you ask yourself, DI patient, they don't have ADH, and therefore they're losing a lot of water because that's what ADH does. It hold on to water. Therefore, if there's no ADH, you're going to lose water. If I give you desmopressin, which is a form of ADH, you're going to hold on to your water. That's all. Then anything that is related to holding to your water is a fair game. What is the idea when I give you desmopressin? What is the doctor looking for? He's not looking for side effect. He's looking for something that I expect is going to happen. Okay, your urine output is going to decrease. It's an unexpected finding, right? You're going to stop drinking, decrease thirst because you hold on to water. Your urine specific gravity that was low because you're losing water is going to increase. Test taking strategy. And no, this is not good. Diminished mental status, that means you have hold on to water too much, that your sodium is too low. Hyponatremia, if nobody has told you before, the reason why we worry about patients with DI because they don't have what? ADH, so they lose a lot of water. As soon as you give them ADH, you're turning them into what? SIADH, syndrome of inappropriate secretion. It's counterintuitive, but you have to bring your critical thinking. I'm DI, I don't have ADH, and therefore I'm losing all my water. If you give me ADH, I'm going to hold on to water. If I hold on to water too much, I will dilute my sodium and I will have what? Seizures, hyponatremia. That's why one of the side effects of one of the most biggest complication of SIDH is they hold on too much water. They make your sodium low. They become hyponatremic and you get seizures. When I'm treating you, I don't want you to have seizures. I don't want to cause hyponatremia. I'm okay to accept this because I know these are therapeutic effects in order for you to stop losing water. But when I see diminished mental status, it's not a therapeutic effect. This is an adverse effect. Somebody will argue, yeah, your sodium is going to go low because you're holding on it. But that is the reason, not the reason why we give you the medication. Is a side effect. It's an adverse effect of that medication to make you hyponatremia and diminish your mental status. Test taking strategy. You can use B-sharp to answer this question. It's a form of prioritization in a different form, but it's all content-based for this patient. I don't like this. Okay, guys, one down. So that's the number one. Number two, same concept, the same medication. I'm trying to hit you hard over there. Which of the following in clinical, in client history, okay, will make the nurse question the prescription? There's something in the history of the client that will make me question the prescription. A nurse is caring for a client with diabetes insipidus, like I described it to you, no ADH, and you give them ADH in the form of Desmopressin. Which of this in their history will make you question? Think about it. We already described it. I have no ADH. I give you ADH, you hold on to water. So your fluid volume increases. You become overloaded with fluid. You get hyponatremic from that, excessive, right? So which of this should you worry about? Look at the clinical situation and see if it's the most prioritized bad stuff. I know if you have a diarrhea, you're holding on to water is good. This has nothing to do with gout. It's not affecting your uric acid. You have retinal detachment. There's nothing related to that. CHF, if you have heart problem, anybody with cardiovascular problem, you should worry when you give them desmopressin because they're going to have fluid overloaded. We push them to the edge. Therefore, CHF is bad. You see, I did not use anything. I used whatever words they've given me. I use the contents I needed, and I break down the question, and it pop up like a candy. Last one, same thing. Watch it carefully. Select or apply, right? Which of the following will make the nurse question the same thing, question the prescription? A nurse is caring for a client, prescribe what? Calcium supplement for bone health. Okay, so they have bone problem. I underline the bars, right? And I show you the case. I read from the back. I show you the question behind. You have a bone problem, right? We give you a calcium supplement. That means I'm increasing your calcium. Which of those in your history will make you question? Sometimes you have to look at a question, think about it, and rewrite it the way it sounds. The way they've written it, you don't see it well. The way I wrote it, you can see it better. But the way I stated it by breaking it down, bone disease, I'm giving you a calcium supplement, means I'm increasing your calcium so that your bone disease can improve. If you have this problem in your history, something you should question about. If I'm going to increase your calcium, you should not have any condition that is also increasing your calcium. If your calcium is low, yeah, I'll give you supplements. You're good. If you have kidney stones, nephrolithiasis, most of kidney stones are calcium based. That means your calcium is too much already. And if I give you calcium, you're going to get 4 more calcium stones. Hey, I don't like you. Hypophosphatemia. Think calcium and phosphorus are in inverse relationship. When calcium is high, phosphorus is high. Patient phosphorus is already low. No, when calcium is high, phosphorus is low. Patient phosphorus is already low. That is hypophosphatemia. If you give them more calcium, their phosphorus will go down more and more and more. That is not good. Their phosphorus is already low. If you give them more calcium, phosphorus will go low, low, low. Therefore, I should question this. Cancer with bone metastasis. This is your bone. If you have cancer there, it's going to chew your bone. And it chew your bone, it releases your calcium. So it make your calcium already high. If you have breast cancer, you go to your bone, your calcium is going to go high, hypercalcemia. If you have prostate cancer that go to your bone, your calcium is going to go high. Therefore, test-taking strategy, critical thinking. If your calcium is already high, why would I give you a calcium supplement? I got to question this. Hyperphosphatemia. I told you calcium and phosphorus are in inverse relationship. If your phosphorus is high, yeah, I don't like you. Therefore, if I give you calcium, it's going to drop your phosphorus. I want your phosphorus to go down. Therefore, if I give you more calcium, phosphorus is going to go down. Therefore, this one is good, right? Therefore, 1 and 5, you don't need to question. Okay, if your phosphorus is high and you give them calcium, it's fine. The nurse does not need to question because high phosphorus, when you give them calcium, it would lower their phosphorus, which is good. If your calcium is low, I give you calcium, it will bring you back. But if you have kidney stone, I give you calcium, you form more kidney stone. If your phosphorus is already low, I give you calcium, you go down. It's not a good thing. If you already have high calcium from bone metastasis from cancer, your calcium is high. If I give you calcium, it's going to be too high. Therefore, the right answer, some people get confused, is check, check, and check because the question said, question the prescription. So these 2, 3, 4 are the things you need to question. Test-taking strategy, pharmacology. I hope you enjoyed yourself. Number 2 is done. Take care of yourself. Bye-bye.